Hey everyone, today we're diving into a medical mystery that's actually pretty common, but man, can it be alarming when it happens to you. We're talking about that strange lump that can show up behind your knee. So let's figure out what your body's trying to tell you.
So, imagine this. You're just going about your day, maybe you're stretching or getting up from a chair, and you feel something. A weird fullness, maybe even a soft, kind of squishy lump right in the crease behind your knee. Yeah, that's the kind of thing that definitely gets your attention and can make your mind start to race, right?
All right, so let's get right into it. What is that thing? Let's figure out what's really going on back there. Okay, so this lump has an official name. It's a Baker's cyst, or sometimes you'll hear it called a popliteal cyst. And really all it is a small sac that's filled with synovial fluid. Now, synovial fluid is the natural lubricant your knee makes to keep everything moving smoothly, kind of like oil in an engine. The problem isn't the fluid itself. It's that your knee is making way too much of it. And all that extra fluid is what causes that lump or that feeling of tightness, especially when you try to straighten your leg all the way. It might feel stiff or even painful, particularly after you've been active. But here's the wild part. For some people, there are no symptoms at all. They just find it by accident. But this is where the story gets really interesting, because it turns out this is about a lot more than just some random lump. That's right. The cyst itself, that's only half the story. It's not the real problem. You should think of it more like a clue in a detective novel. And this is absolutely the most important thing to understand. A Baker's cyst is a signal. It's like the check engine light on your car's dashboard. The light itself isn't the problem, right? It's just there to tell you, hey, you need to look under the hood. That cyst is your knee's way of screaming that there's a different problem happening deep inside the joint.
So here's how it happens. When your knee joint gets inflamed or injured, your body kicks into protection mode and starts pumping out extra fluid to cushion everything. But that fluid builds up pressure, and it's got to go somewhere, so it pushes its way out the back of the joint. And here's the kicker. It gets trapped there because of a sort of one-way valve effect. Fluid can get out, but it can't easily get back in. And boom, you've got a cyst.
So what are these under-the-hood problems? Who are the real culprits making your knee so angry? It's usually things like osteoarthritis. That's the common wear and tear arthritis. It could be an inflammatory condition, like rheumatoid arthritis. Or it could be a direct injury, like a tear in your meniscus or an ACL injury. Even something like gout can be the trigger. Now, I have to make a really important distinction here. In adults, a Baker's cyst is almost always a sign that something else is going on. But for kids, it's a completely different story. They can get these cysts without any other problem in their knee. And a lot of the time, they just go away on their own. No big deal.
Okay, so if you have one of these, how does your doctor actually crack the case? It's time for a little medical detective work.
Well, it's a pretty logical step-by-step process. It all starts with a simple physical exam. Then, to be sure, they'll likely use an ultrasound, which is a great tool to confirm that, yep, it's definitely a fluid-filled cyst. And finally, if they need to see the whole picture and find that root cause we've been talking about, an MRI is the gold standard. It gives them a crystal clear view of everything inside your knee joint. During that physical exam, doctors often look for a classic clue called Fuchs sign. And this is actually pretty cool. When your leg is straight, everything is tight back there, and the lump feels firm. But when you bend your knee, the muscles relax and the lump suddenly feels soft or might even seem to disappear completely. It's a simple but really clever little test. But let's change gears and talk about a more urgent situation. What happens if, out of nowhere, you get a sharp, sudden pain behind your knee and it starts to travel down into your calf, and maybe your calf starts to swell up and get red? Okay, this is a moment where you need to pay very close attention. Because when those symptoms appear, it is absolutely critical to rule out something much more serious, a deep vein thrombosis, or a DVT. That's a blood clot in a deep vein. And the scary part is, the symptoms can look almost identical to a Baker's cyst that has ruptured. So let's compare them. A ruptured cyst is super painful because that fluid leaks out into the calf muscles and causes a ton of inflammation. But a DVT is a genuine medical emergency because a piece of that blood clot can break off and travel to your lungs. This is exactly why you never ever try to guess what's going on. You need a medical professional to tell you for sure. All right, so the detective work is done, the diagnosis is in, so what's the plan? How do we finally solve the knee's message? Well, the real solution brings us right back to our main point. You don't treat the cyst, you treat the cause. A doctor could drain the fluid and you'd feel better for a little while.
But if you don't fix the underlying issue, that arthritis, that meniscus tear, the cyst is just going to fill right back up. The goal is always, always to fix what's actually wrong inside the joint. So let's bring it all home. What do you need to remember? 1. A Baker's cyst is a symptom, not a disease in itself. 2. It's a flashing sign pointing to a problem inside your knee. 3. Getting an accurate diagnosis is absolutely crucial to find out what that real problem is. And 4. The only lasting solution is to treat that underlying knee problem for good. And that just leaves us with one final thought. A Baker's cyst is a perfect example of how our bodies are constantly sending us signals and messages. The real question is, are we listening?